now let us look at section 17. We are looking at the diseases of the parathyroid gland, and here the session covers abnormalities of the parathyroid gland, namely hyperparathyroidism and then the hypoparathyroidism. So students are taught how to recognize these conditions and also assist in the management of patients suffering from them. And at the end, it is expected that students should be able to identify patients suffering from disorders of the parathyroid gland and then offer appropriate nursing interventions or management for these patients. And so here we have the hyperparathyroidism, which is topic 1, and then topic 2 we have the hypoparathyroidism. Of course, the hyperthyroidism, the opposite is hypoparathyroidism. And so these are the things that we are going to look at. So first, hyperparathyroidism. And introduction, there are 4 parathyroid glands situated on the anterior neck, posterior to the thyroid gland. Occasionally, other parathyroid glands may also be found in other parts of the neck. Each gland is of size of like a grain of rice. And so the parathyroid glands secrete parathyroid hormones, PTH. We have parathyroid hormone, and then also we have the parathyroid as well. And then so the parathyroid hormone helps to regulate calcium homeostasis, and then phosphorus, and then also vitamin D levels within the bones and then in the blood. And so the parathyroid hormone acts to increase the levels of calcium in the blood. And so we have the calcitonin, a hormone produced by the parafollicular cells in the thyroid gland, acts to decrease the calcium concentration in circulation. And that is exactly what we are doing. So hyperparathyroidism, what happens? So the parathyroid gland secretes too much parathyroid hormones, and then high levels of PTH causes blood calcium levels to also rise. And here we have the hypercalcemia and low serum phosphorus levels, which is the hypophosphatemia, is also likely to occur. And then we have the hyperparathyroidism, can also be primary or secondary in nature. And so primary hyperparathyroidism is of unknown cause, though it appears that adenomas or enlargement of the parathyroid glands may cause it. And so secondary hyperparathyroidism is a physiological compensatory hypertrophy of all the parathyroids because of the hypocalcemia. And so hypocalcemia occurs in renal failure, or even when we have vitamin D deficiency. And we have signs and symptoms. We have the tiredness is likely to occur, muscle weakness, depression, and then we may also have dehydration, and then bones pains, and then loss of concentration in the individuals who may be affected. And so there are a lot of investigations that we can do. We can do fasting serum calcium levels and then phosphate tests, and this may reveal high levels of serum calcium and then low serum phosphate levels. And then we can also have serum PTH test. This normally may reveal high levels of PTH, and then we can also rely on ultrasound scan or ultrasound in general, which may also indicate calcium deposits or kidney stones in the affected individuals. And so the management lies on the fact that we need to encourage high fluid intake in the affected individual, decrease calcium and then vitamin D intake, encourage moderate physical exercises such as brisk walking and then jogging, and then surgery may be done to remove some parathyroid glands, and then drug such as calcitonin is also useful. And then complications of hyperparathyroidism, we can look at the osteoporosity and then bone fractures and then peptic ulcer, and then pancreatitis in general is likely to occur. And the opposite is the hypoparathyroidism. And here, when the serum levels of the parathyroid hormone is too small, it's termed as hypoparathyroidism, and the most patients with hypoparathyroidism have low blood calcium levels, and then hypocalcemia and high blood phosphorus levels, and here we have the hyperphosphatemia. So these are things that we need to look at, and the causes we have labeled them down here, and the opposite. So just look at the destruction of the parathyroid tissue post-surgical, and then we can look at the post-radiation factors, and then autoimmune. We can also have the metastatic infiltration and the heavy metal deposition such as the iron. These are some factors, and then other factors are also here, which later. And the clinical manifestation, we have the dry skin, thick skin, coarse and then brittle hair, and then impaired vision, premature cataracts, and then palpitations. We also have these arrhythmias and the muscle twitching in the individuals, and then diagnosis points are serum calcium test, which may reveal low blood calcium levels, and then serum PTH levels estimation may also show significant low blood levels, and then serum phosphorus estimate may also show high blood phosphorus levels. And management is aimed at treatment of to bring the blood levels of calcium to normal, and then calcium carbonate, and then vitamin D supplements such as calcitrol, and then others may also be given. Diet high in calcium and then low phosphorus, and then let us look at some of the examples here. We have good source of calcium, which is milk, cabbage, and then soya beans. Source of phosphorus are red meat, dairy, food, and then we have also fish, and then poultry. And then complications, we have stunted growth, cataracts, post teeth development. We also have slow mental development, and then others are also there. So just do further reading on this. These are minor conditions, and then we don't need to spend so much time on it. References are here. Thank you very much.